It is South Korea's first winter since downgrading the infection level of COVID-19 to its lowest and treating it like seasonal flu. But the easing of COVID-19 restrictions has also come with surging cases of other respiratory diseases that are spreading across the nation simultaneously. For more on this latest trend, we're joined by Dr. Alice Tan. Dr. Tan, thank you for joining us.
Thank you for having me.
Now, Doctor, first of all, the country is seeing flu, pneumonia, and COVID-19 circulating all together at the same time. How serious is the situation?
Right. According to the KDCA, during the first week of December, we logged the highest number of influenza-like illness cases in the community over the last 5 years. So this represents about a 1.6-fold increase in the number of patients who are coming in with high fever and flu-like symptoms into the outpatient setting over the last 4 weeks. So almost twofold increase over the last month. And so we are seeing a lot of cases of people who are having acute respiratory illnesses. In terms of the seriousness, I would say the most serious indicator right now is the increasing number of people who are age 65 and older who are admitted to the hospital because of acute respiratory illnesses. So this older population is making up about 40% of people in general wards and 50% of people in ICUs who are admitted due to an acute respiratory illness. In terms of what people are infected with, of the influenza-like illnesses, 42% were actual influenza cases. But we're also seeing an increase in bacterial pneumonia cases that are coming in. There has been an increase. It seems to maybe have plateaued in terms of the cases of mycoplasma pneumonia and streptococcal pneumonia. But right now, this is we're heading into the peak, I think, of acute respiratory illness season. Usually it's the last week of December, first week of January is when we see the peak.
Well, Dr. Tan, you talked about the spread among older population, but the outbreak is also spreading predominantly among young children too. Why is that?
Right. So as you mentioned, we're seeing a lot of respiratory illnesses in children as well. 1/5 of the patients who are in ICUs due to respiratory illness are children between the ages of 1 and 6. In terms of the reason, I think one reason might be a relatively low uptake of influenza vaccination. Of the children between ages 6 months and 13 years who were supposed to get 2 doses, only 43% received that second dose. And so that means they do not have that full immunity against influenza. And of course, influenza spreads very easily in indoor settings, in places where people are congregated. The other respiratory viruses as well, rhinovirus and the bacterial pneumonia causes also spread very easily in indoor settings. And because it's so cold, everyone is congregating indoors. And I think that's the reason why we're seeing an increased spread in schools, in hagwons, where kids are in indoor settings together.
Right. Now, is it possible for us to catch more than one respiratory disease at once? And what happens when we do?
Right. So during the acute phase of the COVID-19 pandemic, there were several cases, documented cases of people who had co-infection of COVID-19 and influenza. Certainly, you can get co-infected with 2 viral strains of a respiratory illness. Unfortunately, when you do have a co-infection, that usually leads to a more severe disease.
Now, back on the COVID front, does South Korea have to be concerned about the spread of the new COVID variant JN.1 that's now spreading in countries like the U.S., India, and China?
Right. So according to the WHO and the US CDC, JN.1, which is an offshoot of the BA.2.86 subvariant of Omicron, poses a low risk globally. So when we consider the risk, we are taking into account the virus's transmissibility, the virulence and also the effectiveness of our current diagnostics and treatments. And it looks like the JN.1 subvariant is perhaps the most transmissible of all the versions of the COVID virus so far. This is probably due to increased immune evasiveness. But in terms of virulence, in other words, how severe disease it causes, it doesn't seem to be causing any more severe disease than the other circulating variants. And the good news is that our diagnostics and our treatments still seem to be effective against JN.1. Here in South Korea, we haven't made that distinction between BA.2.86 and JN.1. They're still grouped together in terms of the tracking, but it is the growing variant in terms of the number of cases that are sequenced are of the BA.2.86, and it is predicted that it will become the dominant strain in the next weeks to come.
All right, Dr. Tan, we will have to wrap it up here. Thank you so much for your insight.
Thank you for having me.